Welcome to the Swiss Liver Patients Association, Swiss HEPA. Today with the interview of PD Dr. Christoph Jüngst, Senior Physician at the Clinic for Gastroenterology and Hepatology at the University Hospital Zurich, with the topic Herbal and Dietary Supplements Induced Liver Injury. Welcome, Dr. Jüngst.
Hello, Mrs. Bobsin.
My first question, what is a herbal and dietary supplements induced liver injury?
Well, herbal and dietary supplements also can cause liver injury. Many people don't know it because they think herbals don't cause anything. They're natural products. They don't cause anything, but also they can cause liver injury. Most of these liver injuries are unspecific hepatitis. There are some rare events where they can cause also cholestatic liver injury.
What is the average latency period?
The latency period, that means when you start to take this preparation until liver injury occurs, is about 1 to 6 months in most of these preparations.
How common is it?
It's most likely rare, but the incidence is probably rising within the last years. We don't have so much data, but we have some data from the registry studies to these compounds and to drug-induced liver injury. And in former years, about 15 years ago, was the percentage of herbal and dietary supplements on all drug-induced liver injuries was about 7%. And 5 years ago, 6 years ago, it was already 20%. So they are rare, but they are rising.
What are the symptoms?
Symptoms are generally mild. Patients only have abdominal pain or maybe vomiting, nausea, some fatigue. There are unspecific symptoms. Only in really rare cases when patients develop severe liver disease, acute liver failure, they have symptoms like jaundice or hepatic encephalopathy, which may progress to coma.
Who is at risk?
This is a very difficult question. Potentially everybody is at risk to get a liver injury because they are not really clearly defined risk factors. We know that they are associated. One of these, the green tea extract, for example, are associated with some genetic risk factors, but we don't know too much about the risk factors. What we know is that patients who have really already a severe liver disease, namely liver cirrhosis, they are at risk for a severe disease course.
How can you protect yourself?
Well, for these substances, there is in most cases no really shown efficacy, though there is no reason really to take them. Though the best is to avoid these substances, but if you want to take them, at least discuss it with your taking physician, because he should also then check if they interact with your other medication, with your drugs, which could also be the case. And then if you start these substances and you have these unspecific symptoms like abdominal pain or fatigue, contact your physician and he can take blood and he can see if the liver enzymes rise, for example.
What can be done if liver injury is suspected?
When liver injury is suspected, contact your physician and he should exclude in the beginning other reasons for liver disease, for example, viral hepatitis or autoimmune hepatitis. But then these substances have to be stopped because they don't have a clear indication and you can stop them. Then a follow-up is necessary to check the liver enzymes after stopping the medication. In most cases, the liver will regenerate and there will not be a greater liver damage. But there are some severe cases where there might be progressive disease and therefore a follow-up is necessary until it's clear that there is no chronic or even progressive disease.
How is it treated?
The major point is to stop this preparation, and this is in most cases is that fine. Liver regenerates. There are these rare cases where there's progression to really acute liver failure with jaundice, coma, and then a liver transplantation is the last option for these patients.
How can one report side effects or damage caused by herbal and dietary supplements?
These side effects can be reported to Swissmedic. You can also discuss it with your caretaking physician, with your home doctor, and then he can also report them for you. Probably that's the more easier or better way.
My last question, as a specialist, what do you recommend in case of herbal and dietary supplements induced liver injury?
Okay, I would stop these substances and don't take them again. That I think it's clear. Then follow-up is important because there are rare cases where with progressive disease, acute liver failure. When you're sure that's fine, when the liver enzymes are in the normal range, then everything is fine, and don't take them again.
Thank you very much, PD Dr. Jüngst, for your comprehensible and helpful interview, which is an additional important source of information for patients. Thank you very much.
Thanks a lot to you, Ms. Bobson.